the government has announced booster vaccines for an extra 25 million people will be fast-tracked in the fight against the COVID Omicron variant.
But with reports of people queuing for hours at walk-in centres and unable to book appointments over the phone or online, is the NHS prepared? We're joined now by the Minister for Care and Mental Health, Gillian Keegan. Very good morning to you.
Morning.
So, we have a number of people getting in touch. In fact, I've tried to book a booster for someone and discovered that they aren't eligible. People have got in touch to say they're being told they're not eligible, but yesterday they heard that all over 18s will be eligible for a booster and the wait is going to be cut from 6 months to 3 months. So, what's gone wrong?
Well, nothing's gone wrong. Obviously, we got the advice from the JCVI yesterday. It'll take us a little time to operationalise the plans, and we will be announcing those plans. In fact, there's going to be a press conference later on today where they'll be laying out some of those plans. But, you know, from the advice of the JCVI, we then basically said we were going to follow and accept that advice. But it does take a little bit of time to operationalise. But don't worry, we will be getting round to it. But people right now don't come forward to book. We will be letting you know when your cohort is due.
So that seems
also
to
when
be a
the
little...
booking system is open, because it still says, I think, 6 months on it, and it needs to obviously have 3 months.
Yeah, because that seems to be a little bit of a mix-up in the messaging. If you're going to tell people that they're eligible and that you're reducing the wait, it is an expectation, especially when you're hammering home the importance of the booster. I think people would expect that they could then go ahead and do it. Is there a reason why you couldn't get the infrastructure in place and then tell people, right, doors are open, go ahead?
We told people as soon as we got the JCVI advice. I mean, obviously, we only learned of this variant in the last couple of days as well. I mean, we've responded very quickly, very proportionately, very balanced way, but very quickly. But, you know, if we'd have waited until we got something from, you know, the IT team and you know, the operational plan, then, you know, we would have been asked questions about whether we were going to do it or not. So either way, we'll be asked questions. But for everybody who's coming forward, thank you so much, because all we want is for people to come forward, obviously, to get the jab when we're ready. But all those people who haven't had their first jab, please come forward. Second jab, please come forward. The booster, we'll be getting in touch and you'll be able to use the booking system very soon. We'll lay out those plans very shortly.
Can you be any more specific than very soon? Because that's extraordinarily vague. You saying in a week's time, if you can give us a week, we'll be up and running?
A couple of days maximum, but the press conference later on today will lay out more information as well. So they're working on operationalise it. There'll be more information later on. And then, you know, but no, it won't take very long.
What is the effectiveness of the 3-month gap after the second jab? Is that the recommended time, or are you reducing the recommended time because you want as many people to get that booster as possible?
Well, we're reducing the time based on the JCVI advice, and what they've looked at is the balance of risk between trying to get more people to get boosted earlier to build up the wall of defence for something which is quite an unknown at the moment. To be honest, we don't know yet the impacts that this variant will have, and we don't know the impacts that it'll have on the vaccine. But what JCVI have looked at is they've looked at the balance of risk and said, let's get more people. So we're doubling the amount of people who are eligible for the booster, more or less, and so let's get more people boosted sooner than we were going to do, to just really build up that wall of defence as high as we possibly can.
We've had 3 more confirmed cases in Scotland of the Omicron variant. I think that's 14 in the UK now. Lots of people asking why the government hasn't brought in pre-flight testing for people coming back into the UK. Much like if we were flying somewhere from here to go to another country, most of those countries you have to have a PCR test 3 days before you fly. Is that something the government's looking at bringing back? Because I think the Dutch found that 13 out of 61 COVID cases identified on Friday amongst travellers arrived on 2 flights from South Africa. They were the new variant. Stopping those people from flying before they've landed because they've tested positive would be seriously advantageous, wouldn't it?
Well, obviously, we're going to keep all these things under review. What we're trying to do, as I said, is to be balanced and proportionate. What we don't want to do is, you know, for everybody to stop flying. It's been very hard on the travel industry, and obviously, you know, that many people have enjoyed going to see friends, family, relatives, etc. So we've said, you know, continue your plans. Obviously, the PCR test on day 2, what that does is allow us to use that for genome sequencing. So that's why we've put in place the PCR test. And, you know, we're working very very closely with the scientific community as well. But really, we don't know an awful lot about yet about this variant. But of course, we keep everything under review, and as we find out more information, then we may introduce new measures.
Is the concern if you introduce pre-flight PCR tests to come back into the UK or fly to the UK, that would just increase the costs on families, and you don't want to deter that at the moment?
Well, we're trying to be proportionate. We don't know very much about this new variant, so we're trying to be proportionate. As I said, the PCR test is very important for genome sequencing, which is actually the sequencing that allows us to see where the new variants are, and also to identify new variants and then say if they're a variant of concern.
Yeah, and a positive test before someone was to fly would be important as well, wouldn't it? Because it would stop them flying here in the first place and spreading the virus further.
Sure, and what we've said is we'll keep it under review. We've found out about this. We don't know an awful lot about it, so we're trying to be proportionate, we're trying to be balanced. We've put in place things that will help the genome sequencing. But of course, as we find out more, we need to just buy time at the moment. We need to buy time for our scientists to work with international scientists and to give us more advice. Right now, we don't really have that very much information to put in place, all of the systems. But we know how to do this. We will obviously take the advice when we get it. But right now, what we're trying to do is slow it down, buy some time, give the scientists time to give us a proportionate response.
You've also introduced masks, of course, back into shops and public transport. We spoke to someone who runs a supermarket earlier and a union member for public transport workers. They are very concerned about enforcement. How are you expecting, as the government, shops and public transport to enforce mask wearing? If someone comes in and says, I'm not wearing one, whose job is it to tell them they should?
It's the police who ultimately enforce the laws that we have in our land. But, what we've relied on all along, actually, is the great British public doing the right thing. And the vast, vast majority of people have responded really well to these rules. And when they change, they respond as well. But of course,
I think someone says they're not wearing a mask and perhaps throws abuse at a shop worker, you would say, call the police instantly in that case.
It's not acceptable, first of all, for people to abuse shop workers. They've done a fantastic job, as have the head teachers, by the way, listening to the programme earlier on. All the people on the front line have done the most amazing job, and we should be thanking them for everything they've done.
So you're saying call the police to enforce the mask wearing. Have you provided extra resources?
Of course, that's what they should do. If they're being threatened, of course, that's what they should do.
OK, what if it's just a no? What if it's I'm not wearing a mask? Do they call the police then?
They'll have to make the judgment of when they should call the police or not. What we're saying is, it's not. We obviously have fines to enforce if it's required, but we're not a draconian place. There have been many countries who've introduced, all kinds of draconian rules and stopping people on the street and having drones going overhead. That's not what we've done, and we've deliberately not wanted to do that. And by and large, the British public have been fantastic. So please continue to be fantastic.
OK, we're going to have to leave it there. But Care and Mental Health Minister Gillian Keegan, thanks for joining us this morning.